This talk is on heart failure. On our agenda, we will discuss what is heart failure, what are the causes of heart failure, what are the symptoms of heart failure, and what can I do to manage and treat heart failure. What is heart failure? Currently, over 500,000 Canadians are living with heart failure, and 50,000 new cases are diagnosed every year. Heart failure is the most common reason for admission to hospital. Heart failure means that the heart is not able to pump sufficient blood to meet the demands of the body. It doesn't mean that the heart has stopped working or is beyond repair. Many treatments are available to help patients live longer and feel better. Heart failure can be treated, but not cured. Heart failure occurs when there's a problem with the pumping function of the heart, called ejection fraction. It looks at how well the heart contracts and how well it relaxes. The ejection fraction refers to the amount of blood that is ejected or pumped out of the left ventricle with each heartbeat. The normal ejection fraction is not 100% because the heart does not completely empty with blood with every heartbeat. The normal ejection fraction is about 50% or more. Heart failure with reduced ejection fraction indicates that the left ventricle is not able to eject sufficient blood or oxygen to meet the body's needs. Here, the left ventricle will fill appropriately, but not squeeze or contract normally. Heart failure with preserved ejection fraction indicates that the left ventricle is not able to relax. When the left ventricle relaxes, that is when it fills with blood. Here, the left ventricle is ejecting blood normally, but there is less blood in the chamber, therefore not providing sufficient blood or oxygen to meet the body's needs. Causes of heart failure: coronary artery disease or a previous heart attack, long-standing high blood pressure, heart valve problems, possibly leaky valves, abnormal heart rhythms like arrhythmias, atrial fibrillation, toxins in the form of excessive alcohol intake and some chemotherapy agents, viral infections that target the heart, congenital heart conditions, and genetic or inherited conditions. Symptoms of heart failure: fatigue, shortness of breath on exertion, sudden weight gain, swelling of the legs and ankles, difficulty breathing when you lay flat, or waking up suddenly feeling short of breath. Heart failure symptoms versus COVID-19 symptoms. There are a few overlapping symptoms between these two conditions. Let's have a look. So heart failure symptoms versus COVID-19 both involve a cough. COVID-19 cough might be a drier cough, whereas the heart failure might be a wet cough. They both involve shortness of breath or breathlessness. They both possibly involve difficulty breathing when you're exerting yourself. Something that's different, though, is with heart failure, it's unlikely to have a fever or headache involved with your symptoms, whereas with COVID-19, fever and headache are one of the symptoms. Self-management and treatment of heart failure. When the heart is not functioning normally, your body is not able to deal with the extra amounts of sodium and fluid in the body. So monitoring and tracking your daily weight is important. Also monitoring your diet, specifically your salt intake as well as fluid intake. Follow your heart failure zones. We'll look at those on the next slide. Regular physical activity is important, aerobic, uh, strength training, as well as stress management. And take your medications as prescribed. Heart failure zones. The green zone. This is the all clear. There's no changes in your weight or your symptoms. The yellow zone. This is the warning zone. This is slow down, time to call your doctor. And this would be if you have a weight gain of greater than 4 pounds over 2 days, 6 pounds over 7. If you feel more short of breath than usual. If you find it difficult to breathe when you're lying down. If you have more swelling in your feet and your legs than usual. If you feel more tired than usual, just unable to do those daily activities. If your heart is racing or beating irregularly. Or you have a poor appetite or your abdomen is bloated. So follow up with your doc so you don't end up in the red zone. And this is the emergency zone. It's good to have when you need it. Time to call 911. Don't have your family bring you. The ambulance can take care of you. That's if you have severe shortness of breath or struggling to breathe. If you have new or worsening chest pain. If you have worsening lightheadedness or found you fainted. Or you notice any kind of confusion or an inability to think clearly. These heart failure zones are available in a hard copy, so ask your exercise therapist for a complete details of this document. Summary. What is one thing you learned from this presentation? You may say, the heart is a pump. In heart failure, the heart is unable to meet the blood or fuel demands of the body. You might say, the top 3 symptoms of heart failure are sudden weight gain, shortness of breath on exertion, and ankle swelling. You also might say a healthy lifestyle is key to managing heart failure. For more information, speak to your exercise therapist and attend the Living Well with Heart Failure talk. Thank you.